All right, friends, thanks so much for joining me for this overview of the NCBA Atlas Health Plans. I'm excited to share these plans with you because they are unique, excellent plans that are affordable and give you $0 deductible to boot. So I will explain. Thanks for joining me again. My name is Joel, and these are the Atlas Health Plans provided by FMA Benefits and Tall Tree Administrators, as well as the NCBA, National Combined Benefits Association, which has a number of member benefits associated with it, including one of my favorites is an air ambulance benefit. Per person, $7,000 indemnity insurance for air ambulance. God forbid anyone needs to use that. There's also travel assistance, emotional support animal certification, discounts, as well as other services like hotel and restaurant discounts, theme park discounts, etc. So being a part of this plan comes with its benefits. Now on to the plans. So here you'll see the 4 plans: primary care, basic health, enhanced health, and supreme health. They all build on one another. So the most foot in the door sort of, I should say, toe in the water form of healthcare would be the primary care plan. This plan provides access to the PHCS P&A network with a referral from telemedicine. So this plan does have unlimited 24/7, 365 telemedicine visits. And they all do, which is why you see across the screen there. So example, wake up in the middle of the night with the stomach pain, you're concerned, but there's no urgent cares open, there's no 24-hour clinics open, there's no well, of course a 24-hour clinic would be open because it's 24 hours, right? So maybe you want to go there, but you're not so sure yet that it's that serious, and you definitely don't want to go to the ER because that's super expensive. So you call up to your telemedicine, you speak with a licensed medical practitioner, and they're going to help triage you and say, yeah, you know what, you're good. We'll call you in a prescription, pick it up in the morning, go back to bed. Or they'll say, you know what, this is slightly concerning. If I were you, I would go get in somewhere. And 7 out of 10 times that's triaged, it's handled on the phone, and there's no other visit required. And so that's $0 to you. So it's a great perk. It's a great benefit. Telemedicine is very, very important nowadays. On the primary care plan, you're also getting 3 consultations for virtual behavioral health. This is more like a mental and emotional health provider. You get 3 per year per person on the primary care plan for a $0 copay. The next down here is the in-office visits. You would be able to visit someone in office if telemedicine refers you. And then if they do, you get a $25 copay and you have your office visit covered there for $25. No specialists on the primary care plan. Urgent care, again, in our example earlier, if they said, yeah, you should probably go in, go in and see an urgent care, they'll refer you and you pay a $50 copay at the urgent care at that time. And the last thing that's really a part of the primary care plan is the pharmacy discount savings card. So it's much like a GoodRx card. You're saving up to 80% on certain retail prescriptions. And that's the primary care plan. Like I said, very basic access to healthcare. It's absolutely better than nothing. And somebody with a limited budget would absolutely benefit from the primary care plan. The next step up then is the basic health plan. So everything you have in primary care and then some on the basic health. And better in certain ways. For example, the primary care in-office visit. Well, now you don't need a referral from telemedicine. You can just go in, and all you're going to pay is a $35 copay for a primary care office visit, and you get unlimited visits on the basic health plan, which is, it's very, very cool. Unlimited for $35. Unlimited specialist visits for $75. Again, that's like a cardiologist or an orthopedist or a dermatologist, right? Some sort of specialist. Urgent care, unlimited visits for a $50 copay. This right here is amazing because really my family and I, that's what we use. We use urgent care because we stay out of the doctor's office. We're healthy. We we don't really feel like we need to go. I mean, yeah, we do annual sports physicals for our girls who are in sports and whatnot, but that's somebody's really sick and has the flu or whatever and is just really struggling and maybe needs a prescription or needs IV fluids for hydration or whatever. We'll visit the urgent care. And so that right there is an awesome benefit of the basic health plan. And so I wanted to touch on those first, but backing up here, of course, we do have the same virtual behavioral telehealth benefit, as well as the 24/7, 365 telemedicine benefit. And then on the basic health plan, this is unique, my friends. So catch this. It does have 100% $0 copay for ACA services as mandated by ACA for adults, women, and children. What that means is it's got coverage for all the minimum essential coverage. So if you were to Google MEC or minimum essential coverage, you would see that the Affordable Care Act has an entire list of things that is considered minimum essential. And this plan will pay 100% for those things. Examples are mammograms, colonoscopies, annual physicals, annual checkups, immunizations, things like this, certain types of birth control. Okay, these are all 100% ACA mandated, and therefore this basic health plan pays for 100%. Pretty cool. Okay. PHCS P&A network, practitioner and ancillary, once again here. But again, you don't need a referral like you do on primary care. You can just go in and see your specialist of choice, your primary care of choice, your urgent care of choice within that network. All right. And that's a large network, by the way. You're going to have plenty of options. If you're near a city, if you're not near a city, then, if there's nobody within 50 miles of you, you can just pick one and they'll treat it as in network. Okay. And the same is true for all the plans. On the basic health plan, you do have a lab benefit, $150 copay per panel. You do have a radiology benefit, $65 copay per image billed. So like x-rays and things, right? And then even some major radiology like CT, MRI, PET scans, etc. There's a $600 copay per image billed for a limit of 3 per year. Again, $600 for an MRI, not bad. Some people charge, a lot more than that. Some places charge a lot more than that. So, and you do have a $75 copay, refer to specialist in-office visit. That's saying here's a specialist in-office visit, it's $75 copay for mental, behavioral, and substance abuse outpatient services. All right, so that's the basic health plan. And by the way, there is 100% coverage for ACA covered generic prescriptions, as well as that same pharmacy discount savings card on the basic health plan. So quite a bit of step up from the primary care. And y'all will see the prices for this year at the very end. I'll share with you the rates, and you're going to be blown away. So now we talk about the enhanced health or the supreme health. And I realize I'm going kind of fast. That's because I know this will be recorded, and I know that y'all will be able to pause, rewind, and replay portions of this that you need to. So enhanced health. Now, this is the first plan that has a hospitalization benefit to it. And I want to explain further as well what these terms mean: deductible and out-of-pocket maximum. So on this plan, you have a $0 deductible. You zoom in here, $0 deductible, and these are the out-of-pocket maxes per individual, per family. All right, so the family is just 2 times what the individual is. And what that means is if, let's say, you're a family of 5, well, the primary member has an $8,500 out-of-pocket max, and then the rest of the family has another $8,500 to share between them, for a max total family out-of-pocket of $17,001. All right, and that's if you're a family of 3 or a family of 16. Okay, and anywhere in between. $0 deductible. Let me expand on this. This is absolutely excellent, and it's why I love these plans. Because there's a true $0 deductible, it means that you're getting the plan's benefits right up front. The plan has first dollar coverage. From the first dollar spent on a claim, the plan is benefiting you. The plan is kicking in. The plan is paying for some of your costs from the get-go. And this is very unique in the realm of health insurance today. Okay. So let me explain. On a primary care office visit on the enhanced health plan, each person has 8 visits per plan year combined with specialists. So 8 visits between the two. Okay. So it could be 2 primary care visits and 6 specialist visits, or 4 and 4, or 1 and 7, or whatever. Okay. Per family member, per plan year. And what that means is it's a $25 copay if you're to see a primary care person, and the plan pays 100% of the bill. So what do I mean by this? Let's use specialists as an example. Let's say you go into a dermatologist and they remove a wart from your left elbow. Well, the copay on a traditional deductible plan is just like what you pay to hold the spot on the doc's calendar. It's like your visit fee. It's like what you pay to be there. And then you get a bill in the mail later, and because the doctor bills it off to insurance, and then you'll get that later. It'll say wart removal, $200. And you'll end up paying that bill up until you reach your deductible. Okay, so that's how it typically works. On this plan, you don't pay that. You just pay the copay. The plan pays 100% of the quote unquote wart removal service. So you pay the $50, plan covers the rest. And that is, let me tell you folks, that is impressive and amazing and very unique, like I said. So example, urgent care. You go into the urgent care and you have you're so dehydrated, they need to administer IV fluid, intravenous, drip, saline solution, and get you hydrated again. Well, typically you'll pay a copay on a traditional plan, on most other plans, I should say, and then you're going to get a bill in the mail. Maybe it's $200 or $300, and you have to pay that until you reach your deductible. Not so on these plans. You pay your $50. That's it. The plan covers 100% of the rest for the visit limit. Okay, so for 2 per year. So the question then is, well, what happens after I've used all my visits? Well, then let's say you need a 3rd visit to the urgent care in a plan year on the enhanced health plan. Well, now you just pay the discounted amount because you're seeing an in-network provider, okay, in-network urgent care. You'll pay that discounted amount, and that amount then that you pay goes toward your out-of-pocket maximum. So now if after you've used your first dollar benefits, then your money goes toward the out-of-pocket max. And guess what? Once you reach your out-of-pocket max, the plan covers 100% for covered services. Okay. So I'm kind of going a little bit more in depth on this because that's the most questions I get on these plans. So let me give you another example. What if you need a surgery and let's say it's a outpatient hospital or freestanding facility service and surgery. So you go in, you get a surgery, and you're out of there the same day. Well, you have a $350 copay, and that's it. The plan pays for 100% of the rest. Now, let's say you need another outpatient surgery in the same year. Well, you're paying the amount of the surgery, and that goes towards your out-of-pocket maximum. Let's say it's an expensive surgery. Surgery number 2 is an expensive surgery. The first one was cost you $350, and that's it. Second one was an expensive surgery, and you met your out-of-pocket maximum. Well, you paid $8,500. Well, the plan pays 100% after that. So I hope that makes sense. Now, that's amazing. That's incredible because who's ever heard of having a surgery for $350? And by the way, if you're hospitalized, inpatient hospitalization and surgery, again, if you're admitted for up to 5 days, you're going to pay a $350 copay for that entire hospital admission. And by the way, if you're inpatient on the surgery, you get 2 of them per year, and it's an inpatient thing where you're admitted to the hospital. Guess what? It's a $350 copay. I mean, that is just outstanding. Okay. And so that's how these plans work, my friends. ER, you get one per person on the plan, and it's a $350 copay, and that's it. You just pay $350 for that visit to the ER. Again, outstanding, outstanding. Most people are, seeing 1,500, 2,000, 2,500 or more in a bill for an ER visit. One trip, you might have been there 2 hours, and the bills are outrageous. Okay, this right here, amazing, amazing. So that's all I wanted to go, the depth I wanted to go in on that. The differences between the enhanced and the supreme are simply the out-of-pocket maximum amount is lower on the supreme plan by quite a bit. I mean, by 3,500 or 7,000 for individual and family respectively. And then you're getting a handful more visits. You get 10 visits now combined between the two. You get 3 visits at an urgent care. All right, even lower copays on the supreme plan. Also, you do have a maternity benefit on the supreme plan and no maternity benefit on the enhanced plan. All right. By the way, home health care, you get 10 home health visits for a $25 copay only on both these plans. So again, incredible. By the way, all these 3 plans come with healthcare navigation. So it's a person you can call that helps you understand how your benefits work, where to find the best prices and costs for providers, where the in-network, they'll just help you navigate everything. So it's a friendly person on the other end of the phone that can walk you through what steps you need to take. And by the way, there's also bill negotiation. So any medical out-of-pocket expense over $1,000, you have a professional medical bill negotiator that will go to work for you on your behalf. There's also a high-cost prescription advocacy person that helps you get that prescription lowered. And you do have low copays for tier 1, 2, 3, and 4 prescriptions. All right, on these plans. Okay, so that, my friends, is a basic overview of the Atlas Health Plans. I hope that answers a lot of your questions. Once again, I love these plans. And by the way, they're an excellent, excellent price. So these plans are, you're going to see probably 20 or 30% cheaper than an equivalent marketplace plan. In fact, I know of a friend of mine who's in this category. He's a family plan. He's between ages of 40 and 64, and his Blue Cross Blue Shield plan was over $2,000 a month. All right, and so I mean, look at these rates for that same individual. He could get the Supreme Health Plan for $1,255 a month for his entire family, which is absolutely incredible. And so you'll see here the primary care plan and the basic health plan. There's just one cost if you're a member only. The terminology is employee only. That just means one person. Okay, $119 a month for primary care, $235.34 for basic health. And the same is true whether you're 18 years old or 64 years old. Okay, which is outstanding as well. And you see the member plus spouse, member plus child, or member plus family rates on the primary care and basic. And here you have the enhanced health, and you'll see that there is an age bracket now between 18 and 39, and then 40 and 64. So the oldest family member is what the price goes off of, not the primary on the insurance. It's the oldest family member. All right. And so if you've got a husband who's 39 and a wife who's 41, it's based off of the eldest. Okay. And then you'll see the Supreme Health plans here as well. Again, my friends, these rates are incredible when you compare it to the alternative, which is, again, what we like to compare to the healthcare marketplace, the state healthcare exchange. Oftentimes people are paying almost double this. And so you'll see a lot of savings here. Thanks for joining me, my friends. I hope this quick overview helped you. Once again, please feel free to pause, rewind, replay as needed, and share this information with others who may be interested in these plans. Thank you very much.